The Patient Caring Touch system is a system that standardizes the approach to patient care. It is a framework that allows every single member of the healthcare team to really integrate their capabilities together, that focuses with the patient in the center to ensure that we're improving the health of those that are entrusted to our care. If there were 3 words that I would want people to think of when they're thinking of the Patient Caring Touch system, those 3 words would be guide, gauge, and ground. And the reason why I say that is that the Patient Caring Touch system is a framework that really does guide us on how the entire healthcare team needs to provide patient care and work together collaboratively. It really allows us to gauge ourselves by performance, whether or not it's our personal accountability to our patient or whether it is outcome measures that shows that our interactions are improving the health or not improving the health, and we can make the right adjustments in using evidence-based practice. And it really grounds us in our Army values. It grounds us in our warrior ethos. It grounds us in our AMED values that are part of the culture of trust. And it grounds us in the Army Nurse Corps Creed, which is really our reaffirmation to the values that we have and the commitment that we have to our patients. The Patient Caring Touch system is happening now, I think, for several reasons. There are moments in our history where you have the opportunity to really make a difference and to ride a wave of change, and I think that's where we are right now. We've got a nation that is looking at healthcare reform. We have healthcare organizations that are really looking at how do they make a difference, how do they collaborate, how do they make sure that we're providing the most efficient and effective, cost-effective healthcare. We are an internationally renowned healthcare system, and with 40,000 nurses worldwide, I believe the Army Nurse Corps can make a huge difference in improving the health of our patients, both across the Army, across Department of Defense, and I think we can be collaborative partners with our nation to improve the health of all Americans. The Patient Caring Touch system, I think, really is that chassis. It's the platform that allows us to standardize our practice. It is the enabler for the Army Medicine's culture of trust, which is ensuring that the patient is at the center of everything that we do. It's an interdependent system. Army Nurse Corps officers and civilians and enlisted are part of a healthcare team, and we are very much interdependent to ensure that we collectively are tapping among the expertise of that team to improve patient care. At Fort Campbell, Kentucky, where the pilot project started, we saw improvements in patient satisfaction. We saw improvements in staff satisfaction. We saw improvements in our emergency room where we had a decrease in left without being seen. We had increases in every single one of our documentation for medical management, pain management, decrease in medical errors. Our patients want to be part of their care. We want to make sure that every part of the healthcare team that touches the lives of our patients are interacting together with our patient in the center to improve the life of those that are entrusted to our care. Whether it's the battlefield, whether it's our military treatment facilities, inpatient and outpatient, whether it's OCONUS or whether it's CONUS, we will have one standard of nursing practice that really integrates the collaborative effort and the interdependence of our healthcare team. It is our honor, it is our privilege to be able to ensure that every single patient that is entrusted to our care gets the best care possible. And the Patient Caring Touch system that has the patient at the central focus of everything that we do within this system is why we are implementing this. It is why it is something that is a no-fail mission, and it is something that you will have 100% of my commitment now and into the future.